is Megan Butcher. I'm with Heartland, otherwise known as HCR Manor Care. And I'm the business development specialist, as I stated earlier. I'm one of three. My main focus is community outreach. Our other two business development specialists are what we call the hospital liaisons, or the physician liaisons. So their job is to get into the hospitals, the physicians' offices. When we do the outcome and discharge summaries of our patients, they have that connection and partnership with our hospitals and physicians. So, but I'm going to talk to you a little bit about Heartland in general, but then also talk about, what kind of community outreach that I do in the senior centers, how we bring you guys and clubs into our facilities to do lunch and learns, or brunch and wars as we call them. And, some sponsorships also that we do with the American Heart Association, the Alzheimer's Association, among others. So, and I like to talk, so I promise I'll try to keep this short. Okay. Again, a lot of people say HCR Manor Care, who's that? And then when I say Heartland, they're like, oh, okay, are you the credit union? And I'm like, no. We're the nursing facility. So again, Heartland is short-term and long-term rehabilitation. To throw at you a little bit of our statistics, and I wrote this down so I don't mess it up, the average stay of the majority of our patients or residents is 30 days or less. So our goal at Heartland is to, bring them in for some therapy and get them back home when they're ready to go, okay? And 90% return to the community, and 18% return to the hospital, which is below the industry average. So we really pride ourselves on that. And just to kind of give you a snapshot, we do have over 500 in the United States. What you see in yellow is the post-acute locations. And again, the 4 locations that I work with is Kettering, Miamisburg, Centerville, and Beaver Creek. And to kind of talk about one of them, this is our Miamisburg location. So I didn't want to throw up all these pictures of our locations, but our Miamisburg location is near and dear to me because I used to be their admissions director, so that's still kind of my family and home. But just to show you, one of the outside locations over, it's off of Oak Ridge Boulevard in Miamisburg. And to kind of give you a visual of what our rooms look like, this is a semi-private, a private room, and then what our nurses stations look like on both long-term and short-term side. And this is actually a movie room over at Beaver Creek. All of our locations have, our Beaver Creek location is the only one that has a movie room, but Miamisburg has a really nice coffee shop. Kettering has a very large coffee shop that kind of intertwines with their dining room. And what I want to focus on here is when we do tours, it's nice, the nurses station actually is positioned in a way where all 3 hallways they can see wherever they turn. So if there's call lights on, they can jump up and, answer them in a timely manner. Our Miamisburg location, all of the rooms are private on the MedBridge side. And just to kind of talk to you a little bit about what we call MedBridge. MedBridge is what we call our hospital to home, our bridge from hospital to home. So we're kind of that pit stop in between. We want to get you better and get you back home. And not all of Heartland locations has the MedBridge branding. You have to meet a certain criteria to have MedBridge, whether it be customer service scores, obviously staffing. We take into consideration, Google reviews, the type of care, their hospitals, or not hospital stays, but how long they're with us. So I do want to let you know that the 4 locations in Dayton is actually the first in the country for Heartland, the 4 locations that, I oversee there. So, and to show you the next one here, this is our gym. For the most part, I would say all of our gyms pretty much look the same. Some of the equipment might vary, but again, all of our therapists, what kind of makes us stand out from some of our competitors, they are not contracted in. They're our therapists. They're Heartland therapists. So what I tell families and patients at the hospital when they're getting ready to come to us, they're going to know your name. They're going to know your routine. They're going to know how, far to push you. It's not like you're going to be like the changing of the guards and have 5 or 6 different therapists, which means a lot. So, and again, the list is long, but this is some of our clinical capabilities. To kind of sum it up, we do everything but event. So when I'm working with social workers or I'm talking with families, sometimes I do wear a hospital liaison hat. I was telling Julie earlier, we wear many hats, but when I'm in the hospital and they're saying, yo, can you handle this patient? Can you handle that patient? We can do everything but event. Also, to keep us current, every month our clinical team, admissions, administrators, they have a meeting, and we have what we call the clinical capabilities list. So they always check to make sure we can handle X, Y, and Z. And that list can change from green, yellow to red light. So just to kind of, give you an insight on that. Now the fun stuff. Okay. Some of our business partnerships. We do sponsor the American Heart Association, of course the Heart Walk that they have later in the year, the Heart Gala that's coming up next month, the Alzheimer's Association, obviously the Walk to End Alzheimer's. We not only walk in, but we support. We do a lot of their different fundraisers throughout the year. The Dayton Food Bank, we do quarterly, and we actually have the Dayton Food Bank coming up this Saturday. So we usually have about, I'd say 15 to 20 out of the 4 locations. And the last time we did it right before Thanksgiving, and we did Thanksgiving boxes. So people who don't have a Thanksgiving meal, Heartland comes. We donate about, well, we not just donate the cans and the food, but we donate our time to put those boxes together to get them back out to the senior community. And lastly, we have Rec West. Actually, Michael and Amy presented as one of our speakers about a month or so ago over at the Senior Enrichment Center. And again, we are one of the sole sponsors of their Family Adventure Day coming up in April. And we do a lot of their lunch and learns and all that kind of good stuff. Now, between the 4 locations, these are the senior centers that we are in. We participate in a lot of their, events. We sponsor a lot of their lunch and learns. We're always looking for speakers. So when, not only do we do some of the speaking, but we always provide the food. So I might ask, Amy to come in and speak on behalf of, is it Allwell? To talk about that, or, Transamerica Financial with Michael. So I'm always looking for different types of speakers. Again, everything is pretty much geared towards the senior community, so love to have you if you're interested. And some of the facility events that we have in our buildings, we do have a monthly or bi-monthly bingo and euchre. They love it. We're doing a euchre tournament actually at our Beaver Creek location here this spring. Brunch and More, I really try to have our Brunch and More, or what people call a lunch and learn, monthly. Right now, Kettering is the only building that does not have a monthly Brunch and More. Beaver Creek is starting up in April. Miamisburg has been doing it for years, and Centerville is actually starting theirs up tomorrow. So the Area Agency on Aging, to kind of go along with what Susan was talking about, we're actually doing a diabetes workshop with the Area Agency. They're 6 weeks long for the senior community. And they also were doing one at our Kettering location on chronic disease management, and the senior community loves it. It's kind of like a support group, but also like a class, and it's free. Rehab reunions, these are always fun. A lot of our residents who have obviously graduated and went back home, they can come back, meet the therapy team. We always provide snacks, maybe a speaker. I had Elvis last week come in. Yeah. You'll see pictures in a minute. Heart's Desire. This is actually it's fun. It's mainly for our long-term care residents. We might focus on 1 or 2 of our long-term care residents, and it's kind of like what is one of your biggest wishes that you want to come true? For example, one lady really wanted to go back and see her church family. So we did this big to-do, a dinner, brought her back to her church, the tears were flowing. It's just making, I guess their dreams become a reality. So we try to do that for a lot of our long-term care residents. And then of course we do the monthly fundraisers for the Alzheimer's Association, American Heart. We'll do anything from walking tacos to baked potato bars. Our nurses will have what we call a free scrub Friday, where they can wear whatever scrubs they want for $2. All donations go to, whatever we're doing for the month. So we try to, build morale and keep it fun. And this last Brunch and More, this was actually the American Heart Association. They came and did a cooking demo. We had roughly maybe about 23, 25 participants, and of course everyone got a cookbook. They asked a lot of questions, and they got to taste test. So that just kind of gives you an insight on one of our Brunch and Mores. This was our Thanksgiving dinner for the Miamisburg Senior Center. We had over 80 RSVPs, and I do want to let you know that when we do provide the food, it's coming straight from our dietary department. We don't get food from Rusty Bucket or, you know, a local restaurant. It's actually the food that our residents eat. So just wanted to share that with you. This is actually over at our Kettering building. One of our residents is dancing at the sock hop. This is a 50s party, a seniors 50s prom that we had, and everyone, some of them, dressed up in the 50s getup. This young lady here, her daughter actually made this outfit for her. And of course Elvis participated. He was in the building that day. So just to kind of give you an idea of what we bring to the senior centers. And yes, I was Mrs. Claus taking the picture. You can't see me, but my elves are from the Beaver Creek location, and we hooked up with Rec West and did their Woodland Lights. So we participated, and this just kind of gives you a snapshot of some of the things that we do with Rec West. Again, we'd love to have you come and partner with us to do a presentation at Rec West. Sometimes they do smaller presentations, 15, 20 people, and their lunch and learns can be on and upwards of 100 to 125. So just giving you an idea of what we do there. And of course our team for the Heart and Alzheimer's Walk in 2017. And these are our 4 locations. Has anyone ever been to Heartland or had a family or loved one? Oh wow, okay. Well, I hope you had a good experience. And that's it. So thank you so much.